You're watching America Trends. I'm Mary Burt-Godwin, and we have a very special guest in studio today. And I am currently, I think now after this segment, 1 degree away from some very famous musicians that we're going to talk about, because our next guest is a rock doc. He's also an otolaryngologist. I just learned that word. Dr. Brian Weeks, welcome to America Trends.
Great to be here. Thanks for having me.
I'm just going to read. You're the president and CEO of Director of Minimally Invasive Head and Neck Surgery at SENTA Clinic. Yes. Multidisciplinary subspecialty medical organization dedicated to treatment of skull-based disorders, which I didn't even know what a skull-based disorder is.
Yeah, I mean,
it's a real thing.
It's a real thing, and it's a complicated area. If you think about where the skull base is, I mean, it's basically below your brain and kind of behind your eyes, and it's an area that connects all those parts. So pretty important.
When it says disorder, is that like a disease and or a injury and or what cancer grows there? What kind of disorders are we talking about?
All of the above,
All of the
actually.
Above.
Yeah, I mean, the conditions I treat range from simple stuff like infections or pains to tumors that are growing, and affecting vision and the way people think and blood flow and things like that. So it's a real range, and I think that was probably one of the things that drew me into the specialty. That and the fact that I'm actually a second generation ear, nose, and throat surgeon. So my father.
Oh, yeah, I read that about your dad. So he had a start, and it started in 1972. That stood out to me because that's the year I was born, so it's a pretty bomb year. Wow. So an otolaryngologist, I studied that word overnight.
Yeah, I'm impressed. That's probably a first.
I'm pretty impressed with myself, I have to say. We can just call it a day. We're done here.
Yeah,
okay.
That's a wrap.
Ear, nose, and throat doctor, surgeon. That's specific surgeon, yes. So you started with that, ear, nose, and throat, and then you moved to the skull.
Yeah.
Base of the skull.
Yeah, so the training that we have, it starts with ear, nose, and throat, and it's kind of basic. It starts as basic surgeons, as general surgeons, and then we move into a specialty area, and then in that area we can focus on certain things. And I really spend a lot of time, and in my training, learning how to approach big problems through the nose.
Okay.
So you'd be amazed. I mean, a lot of my friends just call me a glorified booger picker.
Oh, nice.
But in fact, that's an interesting way to think about it.
Yeah,
Rick over here calls me that all the time. But in fact, when you think about the nose and where you can go through the nose, you can get to the eyes, you can get to the brain. So a lot of the minimally invasive things that we're doing in our specialty derive from going through the nose. So you can actually get to the brain through the nose, and you can remove gigantic tumors in the brain through the nose. So we do that all the time. So we'll approach
Do you really? Brain tumors?
Like pituitary gland tumors and tumors that grow into the eyes and tumors that grow into the front part of the brain. As a matter of fact, I just took out a big malignant tumor with one of my neurosurgery partners a couple weeks ago. That was a gigantic tumor that had grown from the brain down through the back of the nose.
Wow.
And entered from the brain into the nose. And so we took it out through the nose. And it's awesome for the patient.
That's
and it's
impressive.
A lot of fun.
A lot of fun for you. Okay, so where did you grow up? I just want to go back to the beginning.
Born in Chicago. My dad was doing his residency, but we moved to San Diego before I was a year old.
Okay.
So I'm basically a San Diegan.
Okay, I feel like I've probably encountered you. I know I've heard your name around town. And
hopefully not in like the back
in a good way, in a good way. And I have had issues always with sinuses and that kind of thing. So I have so many questions for you, personal questions, but also things I think people want to know. The number one burning question, Q-tips or yay or nay? Q-tips.
Yeah, great
Everyone
question.
wants to know this, right?
We have a saying in otolaryngology that says, don't put anything smaller than your hand in your ear or your fingertip in your ear. So the facts are Q-tips are not made to clean your ears all the way down into your ear canal. But if you use them the way they're meant to be used, they're fine.
Which is just
to clean on the outer part of the ear.
It's not deep in there?
No, just the little creases. They're designed specifically to go into those little creases and clean the ear.
We are changing lives here, people, because that is not what I use the Q-tips. I think I hit brain when I go
love
in.
it.
Okay, so no Q-tips.
And people, by the way, just because you'll love this,
yes.
Every week in my practice, I see somebody who injured themselves pretty significantly with a Q-tip. Like punctured their eardrum or did something horrible. This is a classic Q-tip story. Yeah, hey mom, how's it going? Walking in the kitchen, getting ready to get something to eat, and then bump their arm into something, and the Q-tip goes right through their eardrum. It happens all the time.
So then what is the solution to getting earwax? Because then there's lots of things on the interwebs about how to get the earwax out. So how do we clean it? Do we need to go to someone like you and have it professionally done?
Great question. So some people produce a lot of wax. I mean, it's just like everything else in life. There's variations on the norm. For most people, you put a little bit of shampoo or soap in your ears, use your finger, rinse it out with the warm water, dry it with a towel, and you're done. And if you're a wax producer, or you wear hearing aids, or you depend on AirPods, you probably should come in once a year and have your ears cleaned and checked by your ear, nose, and throat doctor. Other than that, people are obsessed with cleaning their ears, and your ears, just like most of your body, is a self-cleaning organ.
Regulating, yeah. I mean, I think we all make it through without going to get the weird stuff done to our ears. No, actually, that takes me to the next question, though, for AirPods, because that is, we're all using them all the time now. How dangerous or are they? Do we know yet the long-term effects of what this perpetual AirPod uses?
Yeah, another interesting question. I think certainly there's, Apple's even done a really good job of letting the customer know when the noise exposure through their AirPods is excessive. Having sound directly into your ears at a high volume is very potentially damaging. So I think just like everything else, if you're maintaining and managing the sound field level or the decibel level of the sound, then it's not dangerous at all, but it has the potential to be very dangerous. So I would just say, don't play the music or the phone excessively loud, and they're actually really, really fine.
Okay. I know that I have some hearing issues, and my parents had them, and so I grew up in a house where the TV was really loud, and then I had the Walkman AirPods on, so now I'm like talking to my good ear, and I kind of make fun of it, but I probably need to see about that too. Here's my last question for you. Then we're going to move on to some other important stuff. But to plug your nose and blow when your ears are clogged, dangerous or not dangerous?
Not
you know what I mean?
Yeah, that's called there's a medical term for that. It's called a Valsalva maneuver, or a Valsalva, and it's something we do when we're scuba diving or on an airplane to equalize the pressure. And it's not dangerous. However, you can do it too forcefully, and if your ears are working properly, you shouldn't have to do that very, very forcefully to clear your ears. And if you don't, are you not able to do that, then you have a problem with your eustachian tube. And we have innovative, minimally invasive treatments for the eustachian tube. And I won't get into too many details about it, but the good news is there are great ways to treat those types of problems that are safe, office-based, and highly effective.
I mean, it's mostly on an airplane, and I think, or driving up in the mountains, and I kind of plug and blow. And I think, though, I'm going to hurt my brain, though, sometimes. Now you're saying it's all related, so now I'm really scared.
It's all related for sure, and you're not alone. And honestly, that isn't really uncommon. To have a little bit of eustachian tube problem when you're in a pressure environment,
it's normal.
It's normal, but as long as you can clear it. If it doesn't clear, then it's not normal.
Okay, so now let's get to some exciting stuff, because you have this practice, and then you also started working with musicians. You are known as a rock doc.
Yep.
So some of these musicians, let's say, we can't name names of who you've seen or what you've treated them for, but maybe you too.
Yes.
Maybe some Aerosmith musicians. So I'm like 1 degree away from Steven Tyler right now, and Bono. Just gonna say that's pretty cool. And how did you start down that road?
Well, funny story. So the way I started down that road was actually my brother worked in the music industry, and our common friend Rick DeVoe and my brother were partners at Bill Silva. Who's
sitting right here.
Yeah,
Mr.
Rick right
producer.
Here. Yeah.
And we gotta get him in this house one of these days.
Rick's got a lot of great stories and incredible, cachet in the music industry. But they worked for a local San Diego promoter called Bill Silva.
I remember Bill Silva.
My brother worked with these guys, and so I used to go down when I was a student at UCSD, an undergraduate student at UCSD. I'd go down there and simply just get free music. They'd have boxes of CDs, and I would go in there as a broke college student. And one day I met Rick through my brother, and then I met a few musicians, some of whom ended up being pretty famous people. And that was the connection. I developed friendships with these people, and ironically, they all had some medical problems. None of them had any money, so I would give them. Imagine that, right?
Yeah, right.
And I would give them advice and just help them work through a lot of the stuff that they were dealing with personally.
Well, I would imagine musicians too have a lot of stuff with their vocal cords, and any cold or anything could affect their singing, so they probably need that helped right away.
If you think about it, I mean, the ear, nose, and throat is really, that's the sweet spot for musicians. I mean, they have to be able to hear. They have to have, ironically, I've taken care of a ton of musicians with eustachian tube problems, because if your eustachian tubes don't work properly, then your sound is kind of blunted and it doesn't sound clear.
Right.
Obviously, their voice, I mean, our specialty encompasses the vocal cords, your sinuses, allergies, all those things directly affect, you know, your acoustic resonance and all those things. So yeah.
Well, and they have these ear pieces in all the time.
Yes.
We're going to have to take a break, and then I have so many more questions for you.
I'm loving it.
Because we have all this product to talk about. As you have SENTA, right?
SENTA Clinic, yeah.
SENTA Clinic, and all these other products. So we're going to talk about that. We have Dr. Brian Weeks. We're going to call him Dr. B Dog, or B, what do we say? What do we call him?
B-Money.
B-Money.
There's a lot of nicknames.
A lot of nicknames
come
for
with
him.
the territory.
Well, we're going to be really close after this, because I'm going to... Did you bring your tubes? You can look into my
I'm going to examine her on air when we come back.
You're watching America Trends.
It's an ear, nose, and throat exam,
Ear, nose, and
right?
throat otolaryngologist. This is the new word of the day, and we'll be right back with more America Trends right after this quick break.